Hello, I'm Dr. Colin Richmond. I'm a board-certified periodontist practicing in Roswell, Georgia, and also affiliated with the Department of Periodontics at Georgia Regents University in Augusta. This is what we encourage our patients to do when they become patients with us. Number one is to use a disclosing solution. Disclosing solution is a little product that you buy in the drugstore. You drop it on your drop on your tongue. You can do this once or twice a week. Swish it around the mouth. You will then see the plaque will stain up either blue or pink. I then will recommend both of the electric brushes, which are the branded brushes available. One is the Sonicare, one is the Braun Oral-B. The Sonicare I will suggest to patients, and there's no scientific study to support that, maybe use the Sonicare in the morning, slowly and efficiently, getting it in between the teeth, around the periphery of every single tooth. The Braun Oral-B is almost like the brush that the hygienist uses to brush and to polish your teeth. It rotates. We love this thing as well. The Sonicare and the Oral-B do different activities and have got different degrees of efficiency, so why not use both, getting the best of both worlds? Instead of replacing your Sonicare every 2 to 3 years, you will, by having both, you'll replace both of them every 4 years. The next modality is that the most important part of your cleaning effort is the cleaning in between the teeth. We recommend the use of a dental tape. A dental tape is easier than a dental floss to use. And as I said right in the beginning, most people don't like to floss their teeth, but it's much better than getting dental disease. So floss those teeth on a daily basis, or as a professor of mine once told us when I was way back when I was at dental school, floss the teeth you want to keep. Then I love and I recommend routinely, if you haven't lost much gum through gum recession, the use of those little toothpicks. There are a number of brands. The easiest is to get the brand called a Stimudent in the drugstore. Use it, have your family use it. If you've got braces, use it. Your gums, if you haven't been flossing and using toothpicks in a while, the gums are going to be tender, they're going to be red, they're going to be inflamed. But after about 3 or 4 weeks, you'll notice that all of that will start subsiding and you are then doing well for yourself. And then the final issue is, we're talking about gum disease. We're talking about plaque on the gums. And there is no scientific evidence to support this, I have developed the concept in our office that all of our patients will either take a little piece of gauze, a 2x2 piece of gauze, wrap it on their finger and put a little Listerine on that and go up and down and back and forth and massage their gums on the outside, the inside, the front, the back on a daily basis. And you will be impressed as to how comfortable that is and how refreshing your mouth feels. This is Richmans' notion. Again, few people do this or recommend this, but you will love it. As an alternative, you can take a baby's soft, delicate washcloth, keep it in your shower. During your shower, wrap it around your fingers, up and down, back and forth, outside and inside, with the same pressure as you would use if you were in the shower using a washcloth on your skin, neither more nor less. And again, it will feel to you as if you have just had your teeth professionally cleaned by your hygienist. So once a day, the gauze or the washcloth, at night in the shower, while you're sitting in your car at the traffic light. You can use the little toothpick while you're sitting in your car at the traffic light. In other words, I say that because there's no necessity to be at your bathroom when you use some of these products. And if you are susceptible to cavities and or aggressive periodontal disease, we would recommend the daily use of fluoride as an adjunct, and for that you need to discuss that with your hygienist. So in conclusion, we've gone through a lot of material very quickly. Please, if you suspect that you've got one or more of the warning signs of periodontal disease that include bleeding of gums, shifting of teeth, tender tooth cleanings, uncomfortable bite, all of the issues mentioned earlier, we'll be keen and happy and enthusiastic to see you if you're in our community, in our neighborhood. Otherwise, seek out the services of a board-certified periodontist and let that individual do the comprehensive exam and team up with an appropriate dentist in order to bring your mouth to good health and keep it in good health for the rest of your life. So, the phrase is, periodontists save teeth, teeth for life. An analogy, which I've referred to, cardiologists save hearts, diabetologists save diabetic issues. There is a lot more detail on this topic on our website, and on the American Academy of Periodontology's website is www.perio.org. Thank you for listening. I hope you enjoyed the program. I hope it was meaningful for you. And of course, we are always there to help you if you have any of the problems or conditions that we discussed during the course of this program. We welcome you, your family, and your friends as patients to our office, and we will work closely with your dentist and your hygienist if indeed you are a patient in need of our services.